Obamacare, financial assistance, the truth about getting free health care in the good old US of A. Now, before we get started, we'd like to point out the fact that we're not here to be political. It's the law of the land. It has been passed. The Affordable Care Act, or Obamacare, as is better known, states that everyone in the United States of America must have health coverage or health insurance. We're just here to point out the facts of how the law makes it possible for certain individuals to get financial assistance, and we're going to go through that. We're not here to say if it's good or bad or anything else. So here we go. First of all, the Healthcare Reform Act provides financial assistance in two different ways. The first is in the form of tax credits, and the second is in cost-sharing subsidies. Now, how does it work, and are you eligible, and how do you figure out if you would be? Well, first and foremost, you must be a citizen or here legally, okay? If you're naturalized or you're here with a work permit or whatever, you have to have a document that states that you're here legally, and you have to have a document number as well as a alien number and so on and so forth. So that's the first point. The second is that it's going to be based on four different criteria, or four things. One is family size, and as you might think, the larger the family, the more financial assistance that you may be eligible for. The second is what plans are available to you in your area. So what is being offered through the major insurance companies in your area will be the second criteria. Then, of course, if you smoke or not. After all, we are talking about health care. And then the big one, income. But not just any income, but rather your modified adjusted gross income, or your MAGI. Now, to figure out your MAGI, it's basically pretty simple, but before we get started, we'd just like to make a little disclaimer. We're insurance guys, not tax guys, so for specific tax questions, seek your own tax advisor. But getting back to the example from the IRS is basically adjusted gross income plus non-taxable Social Security benefits plus tax-exempt interest plus excluded foreign income will give you your modified adjusted gross income. The good news is that for the vast majority of Americans, it's just going to be your adjusted gross income, or your AGI. And finding it is as simple as going to your tax return and looking on line 37 if it's Form 1040 that you filed. And if you filed 1040 EZ, it will be line 4. And then, of course, 1040A will be line 21. Now, of course, these forms have changed from time to time, so the big thing you want to look for is the adjusted gross income line, which is boldface print. It's going to be different on every form, but that's what you want to look at to make sure that you're within the guidelines. So why is your income important? Well, it's all in relation to your income in the Federal Poverty Guidelines, or the FPL. Taking a look at them, the government has come out and said, well, here are the minimums, or the benchmark minimums that you must make in order to be eligible for Obamacare, period. So if you're single and you're making $11,670 or more, you are eligible for Obamacare, or the Affordable Care Act financial assistance. And as you can see, the higher the household, the more that the poverty guideline or the income goes up. Now, this is a starting point. So again, it's this amount or more. It goes all the way up to 400% of that guideline. So you can see here that you, as a single person, could be making, or anybody really, you can make up to 4 times the amount of the initial federal poverty guideline and still be eligible for some type of financial assistance. For example, here with a household of 1, the minimum that you got to make is $11,670, and the maximum that you can make is $46,680 to be eligible for some financial assistance. Now, this will change year on year. So this is right now for 2014. The 2015 federal poverty levels are not out yet because 2015 is not here yet. But as you can see here, so a family of 4, $23,850, and 4 times that amount, they can make up to $95,400 and still be eligible for some type of financial assistance. As we said before, the federal tax credit is one of the ways that is afforded financial assistance that is used to offset your monthly premiums. So if you have a monthly payment for health insurance, what will happen if you qualify for this is that you will receive a tax credit that will help offset those costs or reduce that monthly premium. Now, first we have to understand what a tax credit is. How a coupon works is exactly how a tax credit works. If you got a coupon for $1.50 and go buy something for $3, well, you only pay $1.50 because the coupon gives you credit for the other $1.50. Similar to taxes, let's say you owe $1,000 in taxes. Well, if you have a tax credit of $400, that means that all you got to pay is $600, right? Because having a tax credit is like having a coupon. Simple math will show that 1,000 minus 400 would be 600, and that's why you would only pay $600. Now, traditionally, tax credits are usually at the year end. In other words, they're done once you file your tax returns. What the Affordable Care Act or Obamacare makes it different is that now they are in the form of advanced tax credits. Okay, and how does this work? Well, it works on a monthly basis. That's why it's able to offset your monthly premium cost. And what is important to note is that it is going to be paid from the government directly to the insurance company. Okay, then later on at the end of the year, you're going to receive something similar to a 1099 or a W-2 from the government saying how much they actually paid on your behalf, and you'll need that to file your tax returns. So that's the way the advanced tax credits work. Now again, how much you can receive in the form of that tax credit will go back to what percentage of the federal poverty level that you actually fall into, if at all. If you're making more than 400% of the federal poverty level, then you're not going to be eligible for anything. But if you're making, say, 150% of the federal poverty level, depending on your household size, you will be eligible for some type of tax credit. The second way that financial assistance is afforded to you by the new healthcare reform law is in the form of cost-sharing subsidies. Cost-sharing subsidies will reduce or limit the amount of money that you have to pay, kind of like a speed limit limits how fast you can go. Cost-sharing subsidies will reduce your cost or limit how much your costs are going to be in reference to deductibles and co-insurance. Now, why is this important? Well, because the law basically states that the out-of-pocket cost for an individual is going to be capped out at $6,600 if you're not eligible for the subsidy, or $13,200 per family if they're not eligible to receive the subsidy either. What does this mean? If you're an individual and you have to use health care, you're going to be on the hook for the first $6,600 depending on your co-insurance and things of that nature. And if you have a family, it's going to be the $13,200. So the cost of deductibles are going to be high with the new Healthcare Reform Act. Now, of course, all preventive care is still absolutely free. Things like mammograms, even colonoscopies if you're eligible due to the age, but routine health care is going to be free. So you don't have to worry about that. You're not going to be paying for routine health visits. But if you have to go to the doctor to see because you suffered something else or you go to the emergency room, those costs will apply. Now, another important note is that the cost-sharing subsidy is only available to silver plans. So it's only applicable to silver plans. And remember, one thing that people always get confused is that this is not the one that reduces your monthly payment like tax credits do. What cost-sharing subsidies do, rather, is they reduce or limit the amount you would have to pay when you get a bill for using your health care. Okay, so it reduces your out-of-pocket cost up and beyond your premium. It has nothing to do with your premium. So that's one thing, that's a big point of confusion for a lot of people. Now, what's it based on? Well, similar to the tax credit, it's going to be based on family size and income. So again, the income is going to be based on the percentage that you make in relation to the federal poverty level. But one thing to note of exception, that unlike a tax credit that allows you to make up to 4 times federal poverty level, or 400%, the cost-sharing subsidy caps out at only 250%, or 2.5 times the federal poverty level. So it's going to be less people that are going to be eligible for this. To go and look at it a different way, here's how it would work. Say your percentage of the federal poverty level falls between 100 to 200% of the federal poverty level. You're making 2 times, or you're making the federal poverty level or 2 times that. Then it reduces your out-of-pocket cost to $2,250 for an individual and $4,500 for a family. Likewise, if you are a little more, you're making 2 to 2.5 times, or 200 to 250% of the federal poverty level, then your out-of-pocket costs will be capped at $5,200 or $10,400 per family. That's a substantial difference, or a substantial savings for the rest of us who are above that 250% threshold, which means that we are going to be capped out at $6,600 as an individual or $13,200 per family. Now, of course, here's our shameless plug. If you still have any questions or want help enrolling or anything to that extent, we're available at 1-800-315-0867. We'd love to hear from you, help you out, help you enroll, but the main thing is to get you in compliance with the law. Of course, the services we provide are to help guide you through the enrollment process. We can handle all the paperwork for you. We can maximize tax credits and cost-sharing subsidies, and we can even help you meet all the deadlines because there are quite a few for healthcare coverage. This service is absolutely free. This is a shameless plug, but it doesn't cost you anything to use us. We also offer you a website that's fasteasysignup.com where you can see for yourself if you're eligible for any subsidies and, of course, what plans are available in your area, and they're all calculated for you automatically. You can also enroll for free at fasteasysignup.com because we interface directly with the government's website and allow you to do that. Who we are, we're independent insurance agents. We're certified with this through the Department of Health and Human Services. We are the Apollo Insurance Group, and we certainly look forward to hearing from you, or if you have any questions or want help enrolling, just give us a call again at 800-315-0867.